Health Secretary Sajid Javid has pledged to recruit 15,000 new health workers in 2 months as the government tackles the NHS waiting list in England. Writing in the Daily Telegraph, he said the NHS aimed to recruit 10,000 more nurses from overseas and 5,000 more healthcare support workers by the end of March. On Tuesday, the Health Secretary set out how the NHS would tackle the backlog built up during the pandemic.
On top of this, the number of people waiting for elective care in England now stands at 6 million. That is up from 4.4 million before the pandemic. Sadly, Mr. Speaker, this number will continue rising before it falls.
The government's elective recovery plan sets out new targets for reducing long waits and getting people checked for illnesses more quickly. It says waits of longer than a year for elective care will be eliminated by March 2025.
Within this, no one will wait longer than 2 years by July this year, and the NHS aims to eliminate the waits of over 18 months by April 2023 and over 65 weeks by March 2024, which equates to 99% of patients waiting less than 1 year.
About 6 million people in England are on the NHS waiting list for treatment, including hip and knee replacements, cataract surgery and tests. There are also some plans to hit targets for cancer diagnosis and care.
Returning the number of people waiting more than 62 days from an urgent referral back to the pre-pandemic levels by March 2023, and ensuring that 75% of patients who have been urgently referred by their GP for suspected cancer are diagnosed or have cancer ruled out within 28 days by March 2024.
The number of people waiting longer than a year for care is over 300,000. Nearly 200 times the pre-pandemic level.
Assuming half of the missing demand from the pandemic returns over the next 3 years, the NHS expect the waiting list to be reducing by March 2024.
Prime Minister Boris Johnson said the plan was the biggest catch-up programme in the history of the health service, backed by unprecedented funding. But some MPs said parts of the plan were not ambitious enough. The plan will be funded by the £12 billion raised by increasing national insurance rates. The Shadow Health Secretary, Wes Streeting, said working families are being made to swallow another Tory tax rise, yet this announcement makes clear that people will still be waiting longer for care. Joy Duguid, NTD News.